Welcome, and did you know that today, the 21st of September, is World Alzheimer's Day? And I'm joined by our Director, Communications and Public Health Diplomacy here at the Zambia National Public Health Institute, who wishes to share a testimony around dementia. So could you please share your story with us?
Thank you so much, Dr. Naeem. It's always a pleasure to be here with you. I might be a little bit emotional because I loved this guy. So my grandfather, Mazyanga, died at 96. But the last 10 years of his life were initially annoying, but eventually when we got to understand his condition, quite interesting. There'll be days when he would, so he lived with my parents in the last 10 or so years of his life. And then you go there to visit. And depending on where he's at in that day, sometimes it will be like, Mulibwanji, Timitandizeni. And they're like, why is this guy speaking to me in this language? Because we don't use this language. I'm saying Tumbuka, by the way, and he was Tumbuka, so he would either speak in English or Tumbuka. And then he'd be like, Grandpa, this is me. And then he'd be like, so who might you be? And I'm like, this is Mazyanga. Oh my darling Chibom, come and sit on my lap. I'm like, guy, I'm gonna break your bones, right? And then we'll chat a little bit and then get into other discussions with everybody else, and he'd have forgotten and he got into another space. The next thing he'd be like, hey, can you get me your grandmother? Quickly, I need to talk to your grandmother. And grandmother at that time had been dead quite a number of years before. But his mind always shifted. Very good in remembering the past, and very bad in remembering the just happened, the near past. He'd ask me questions like, are you married? And who are you married to? At that time I already had 4 kids, and I'm like, dude, you even got the bride price. And I was like, I don't quite remember. And who did you get married to? And when I mentioned, oh, you're so wise, you married from our place, things like that. So in the beginning, it was really, really daunting and difficult for my parents who lived with him, but even for us, because, it meant that we had to always be around him. He would lock up the houses. Sometimes if he sees it's darkish, he gets into security mode, because he taught English and first aid and anatomy to the police. So he was an educated man. So sometimes he'll just start locking up the houses, and then he won't even know where he would have placed the keys. So if there's nobody inside, all those who are outside will be in trouble until you find the keys and so on. So yeah, that's my experience in dementia.
I'm very glad that you are sharing the story with us, and we appreciate that you are vulnerable enough to share that part of you. I know, despite you showing this jovial side to Grandpa, I know the memories are also very raw for you, and we truly appreciate that. So colleagues, all Zambians, did you know that today is World Alzheimer's Day? And the theme for this year is never too early, never too late. What do we mean by that? Dementia is actually a group of medical conditions that come up because of a concern that happens in our brains. Now, oftentimes people think that dementia is a normal process or a healthy aging. It's not. The brain requires certain support structures throughout their life. And the risk factors for dementia include things like high blood pressure, non-communicable diseases such as diabetes, high sugars, this is what we call diabetes, and also other lifestyle risks such as diet as well as mood. So these are certain things that can predispose to dementia. In addition to that, we also have what we call strokes, which is where there's a disruption in the blood supply to the brain. And this is the organ that leads to signs and symptoms of dementia, which Director Mazyanga has shared in her grandfather. The most common symptom is often memory loss and memory decline. Not remembering, not able to recall, and having what we call recall bias, where you misplace memories. You are not quite 100% with your memories. These are among the many symptoms. You'll also find changes in mood, where irritability may come up. Anxiety, feeling uneasy can come up in people that may be experiencing dementia. Now, Zambians We are happy to share with you that right now in Zambia, all healthcare service points actually support dementia. Please reach out to your nearest healthcare worker and get the help that you may need, because people that are dealing with dementia go through a lot of abuse in their homes because of the lack of awareness from friends and family, but also people that are aware and taking care of people living with dementia equally go through a lot of psychosocial and emotional concerns. So with that said, please tune in to radio and TV stations this week, as well as this Sunday on Doctor on Air, where we'll be addressing more around Alzheimer's, which is the most commonly studied dementia, and many other types of dementias. Thank you.
Thank you. But before we leave, vulnerability. I know you did mention the risk factors. So prior to that situation my grandfather was in, he was actually involved in a car accident. And I think the clinicians who saw him after that wanted to attribute that to the accident. So physical injury, does that have a potential of causing dementia or related diseases? Secondly, people like us here in the workplace, is it possible? Because there are things like, I do have situations where I'm talking to somebody and then I just can't continue the sentence because I can't remember what I was trying to say. And it's been worse after the COVID. Is it the COVID? Is it my age? Is it something else? So just 2 seconds on that one.
Alright, so with respect to head injury, road traffic accident, so with your late grandfather, if there was a head injury, there is a possibility that the part of the brain that is responsible for the lesion and memory and recall may have been affected, may predispose to that. So there is that correlation, so that risk factor may be there, but that is not the general dementia, because dementia, there are over many types of different types of dementias. When we say dementia, we simply mean there is a change in your basic functioning of your brain, and in that in particular, your memory, your ability to concentrate, your ability to focus, and your emotion regulation can also be affected, among many things. And there are different stages of dementias depending on the risks and issues that may come out. But in addition to that, the point that you raised to say, in the workplace, sometimes from time to time you have what we call brain fog. This is where you have challenges with concentration, or you have times when you are about to say something and you can't quite recollect. This may be due to many things. Your lifestyle right now, you do many things. You may be stressed. That's the first thing that I would say. But not to bring it down or belittle your experience, I would also like to share that, in women, there's also what we call menopausal symptoms, because there are times when you have a change around menopause with your hormones. So that may also be a contributing factor. But also, generally, we've all gone through COVID-19, and having had COVID-19, we now know there is what we call long COVID, post-COVID-19, and in this we are still trying to understand what is it that is leading to cognitive decline. Cognitive means thought processes and emotional decline post-COVID. So we are still trying to understand, but that too is a symptom of long COVID. So we have to actually check, we have to test, we have to do the assessments for us to come up with the right answers.
Thank you so much, Dr. Dalal. This place for more issues around health problems that can be resolved or may not be able to be resolved. Welcome to the ZNPHI, and thank you so much. Bye-bye.